Hello, my name is Ebony Clay, and this will be for the EHR technology presentation for ABC Medical Center. We will be talking about the e-patient new technology that will be coming, and why it is so important for us to us as a staff and as a facility to be on board with this. E-patient, as some of you may know and some of you may not know, um, is a technology that patients use um, to be able to partake in the management of their health. Patients can expect to have the care they need whenever, however, um, they need it. So, for instance, let's say that they're on vacation. And let's say that they come down with the flu, and their doctor is, of course, 3, 4 states away. This is a chance for them to be able to get in contact with their doctor without having to make an appointment. Um, with making an appointment and having to wait for that appointment, it could be weeks before they even get to a doctor or to their own doctor, for example. And they could be sick with the flu and they don't know that they're sick with the flu. So they can have this conversation with their doctor. Their doctor can either say, go to a clinic near you to get tested, and they can have the results then faxed over or be sent to their physicians. It can also help patients keep their physicians informed. Keeping them informed, especially there are more than one doctor or one specialist that one person may be going to. For instance, you may have somebody who has a pulmonology issue as well as a cardiology issue, and they need to be able to share that information with each other in a timely fashion. They may see the cardiologist one day and they may prescribe a different medication, a different treatment that may actually hinder the other treatment that they're getting from their pulmonologist. So this is also a way for them to be able to share in the exact time, in a faster time to their physicians. A lot of technology that patients are now using is their tablets, their phones, and they're doing this with bank statements. They're doing this with e-check. So they're checking on a lot of things when it comes to their daily life. So why not be able to do it with your health? Instead of having to on the phone, wait for your doctor to call you back, wait for the nurse to call you back, you can email them, you can message them, you can keep track of what changes they have made. If you just came from an appointment and you quite don't remember, like most people, what the doctor was even talking about. And so you want to be able to go back and want to be able to review it, want to be able to review it with your patients, want to be able to review it with your families, different diagnosis or treatments. This also helps the patient not keep very much secrets. They'll be able to actually share or update things that they need to update. For instance, if they're a smoker, most likely pulmonologists would deal with this. If they're a smoker and they're looking for ways to quit smoking, they can keep updated on the different smoking cessation treatments that there are to be able to get themselves better. Patients can also access their records anytime. So if a doctor dictates his records and and he puts it into the system, it also goes into that patient portal. That patient can then go back and look up that doctor's notes. A lot of jargon, a lot of language that is used nowadays in the healthcare world, patients don't quite understand. And so they need that time to be able to look up some of those words, be able to look up some of the definitions, get to really know what the doctor or the nurse was actually meaning. Information can also be shared with caregivers and with families, like I mentioned earlier. There are patients that are, especially our elderly patients, who live in assisted living homes who live where they have a caregiver who comes in, a nurse who comes in and checks up on them, checks up on their vitals, and so on and so forth. And they're not always there in the waiting room, in the exam room with that patient. And so they're counting on that patient to be able to relay the message that was given by their physician on their health. So it just makes it easier to be able to transfer those records to the proper people. The patient still has control over who sees their records, especially if it's in a portal form where the patient is the boss and we just answer to that patient like, of course, we're supposed to. There are many different systems that are used in different clinics. Information that caregivers and skilled nursings can import and export onto their own systems. The system is a good way to also keep medications, like I said before, updated, allergies updated. Throughout the years as we get older, our allergies either get worse or they get better with age and time. So with that said, doctors can have the most recent updated version of allergies, medications, to where treatments are not colliding, but yet they're actually still helping the patient instead of colliding and no longer helping the patient. Patients are able to look over their conditions, look over Privacy Act, look over the conditions of the treatment in their own time to be able to better understand it. Also, this also helps patients to be able to build a community, to be able to find a community that and people that are going through the same thing that they're going through. Usually when somebody feels alone and when they feel like that they don't have, that people don't understand what they're going through. Of course, some of your doctors may not understand. They understand what you're going through, but they may not feel exactly how you feel on what you're going through. And so being able to get in touch with people who are going through the same thing that you're going through, maybe there are treatments that are new and that maybe that your doctor hasn't been updated on or aware of. This is an easier way to also lengthen that. Be able to update your doctor, update the patient, update the nurses on new and more trendy treatments that could possibly help you better and not harm your body as much. Once again, this is a way of sharing communication. Also, this can also help with the public health, keeping patients and doctors updated with public health, like the H1N1 epidemic back in 2009, where people are more aware of the situations that are going on instead of being the last person to know. Staying updated with the advocacy groups like American Cancer Association, being able to keep updated with the autism awareness. Also, this will also keeps track and helps people keep track of, let's say, the number of deaths that happen between certain ages, the number of deaths that happen if they had this kind of condition like cancer, or expectancy rate when it comes to children, especially pregnant women who have had miscarriages, why they had miscarriages, necessarily when they had when the miscarriage was done, whether it was in the first, second, or third trimester. This is actually a great way to extend everybody's knowledge. Everybody goes through a lot when it comes through health, when it comes through cancer, comes through autism, viruses, and everybody should be aware and should be able to communicate their concerns. Physicians and nurses are not 100% always right. And so this is a way to be able to let them still be human, to be able to learn and grow and become better doctors and nurses. You can't do that without people, without patients and outside help like the government and advocacy organizations sharing their thoughts and new treatments. I hope that this video was a presentation that could help you better understand why we are changing over to the EHR system. I hope this gave you more of a confidence of using it, and just go for it. There's nothing wrong with learning and growing and changing healthcare world. Thank you so much, and any more questions, please feel free to contact. You have a wonderful day.